For decades, ADHD was seen as a childhood condition, something kids would grow out of. They picture a fidgety kid in school struggling to sit still. But we now know that ADHD often persists into adulthood, changing shape rather than disappearing. Millions of adults live with undiagnosed ADHD, labelled as scatterbrained, lazy or anxious. Worse, many struggle with anxiety, depression or sleep disorders without realising ADHD may be the root cause. Imagine a bustling city street. That's what it's like inside an ADHD brain. Thoughts buzzing, ideas popping, energy crackling. Now imagine trying to focus on one conversation amidst all the noise. That's the daily challenge for adults with ADHD. It's time to shatter the myth that ADHD is just a kid thing. The good news, awareness is growing. With the right strategies, adults with ADHD can thrive, not just survive. In this video, we'll explore what adult ADHD really looks like, how anxiety, depression and other conditions complicate diagnosis, science-backed treatments and practical tips for work, relationships and self-care. Let's dive in. ADHD in adults isn't just trouble focusing. It's a neurodevelopmental disorder affecting daily life in key ways. Attention, easily distracted but capable of hyperfocus, impulsivity, interrupting conversations, impulsive decisions, emotional dysregulation, quick frustration, sensitivity to criticism, executive dysfunction, chronic procrastination, missed deadlines. Many adults develop coping mechanisms, some helpful, some harmful, and because of myths like "I did fine in school" or gender bias, women often get misdiagnosed with anxiety. ADHD goes undetected for years. Left untreated, ADHD can lead to career struggles, relationship strain and crushing self-doubt. But here's the key insight. ADHD isn't a moral failing, it's a neurological difference and it can be managed. ADHD rarely travels alone. Over 50% of adults with ADHD also have anxiety, often from chronic overwhelm, falling behind on tasks resulting in panic about catching up, or rejection sensitivity dysphoria, RSD, which is extreme emotional pain from perceived criticism. And decades of undiagnosed ADHD can spiral into depression, often marked by feeling stuck due to executive dysfunction and shame over unmet goals. Why can't I just do it? Other common overlaps: sleep disorders, difficulty switching off at night, substance use, self-medicating with caffeine, alcohol or drugs, and even misdiagnosis as bipolar disorder. Treating anxiety or depression without addressing ADHD is like putting a bandage on a broken arm. Think of it like this. If ADHD is a loud party in your brain, these comorbidities are the uninvited guests who make it even more chaotic. Imagine feeling the pressure of a deadline, but your mind races with worries, making it impossible to start. This is the reality for many adults with ADHD and anxiety. The combination can lead to procrastination, avoidance, and feelings of overwhelm. Recognizing and addressing these comorbidities is crucial for effective ADHD management. It's like untangling a knot. By addressing each strand, you create space for clarity and well-being. Getting diagnosed starts with a screener test. Steps to diagnosis: 1. Take a screener test. USRS-5 is a free validated tool. 2. Consult a specialist, psychiatrist, neurologist or ADHD coach. 3. Rule out other conditions, for example, thyroid issues, sleep apnea. Bring childhood report cards. Comments like "bright but distracted" are clues. Medication is not a cure. It is like glasses for your brain. Stimulants like Adderall and Ritalin help many. They are first-line treatment, not happy pills. Non-stimulants like Strattera are a good option for anxiety-prone individuals. Side effects to medications are appetite loss and insomnia, which are often manageable. Pair meds with therapy for best results. Therapy that works for ADHD, cognitive behavioral therapy, CBT, helps reframe negative thought patterns. ADHD coaching offers practical life hacks. for example, body doubling for tasks. Mindfulness practices aid in emotional regulation. Lifestyle tweaks matter too. Exercise boosts dopamine, which is low in ADHS brains. Protein-rich breakfast stabilizes focus, and external reminders like phone alarms, sticky notes, and don't put it down, put it away, combat forgetfulness. Section 5. Practical tips for ADHD success. Use visual timers to combat time blindness. Follow the 2-minute rule. If it takes less than 2 minutes, do it now. For relationships, remember, ADHD explains but doesn't excuse. Communication is key. Implementing these practical tips can help you manage ADHD more effectively. With the right strategies, you can turn challenges into opportunities for success. ADHD isn't a curse, it's a unique operating system. If this resonates, take the ASRS screener, link below. Talk to a specialist, join a community like our ADHD or CHAD. Your brain isn't broken, it's wired for creativity and spontaneity. With the right tools, you can harness its power. ADHD isn't a curse, it's a unique operating system. If this resonates, take the ASRS screener, link below. Talk to a specialist, join a community like our ADHD or CHAD. Your brain isn't broken, it's wired for creativity and spontaneity. With the right tools, you can harness its power. Embrace your unique strengths and thrive. ADHD isn't a curse, it's a unique operating system. If this resonates, take the ASRS screener, link below. Talk to a specialist. Join a community like our ADHD or CHAD. Your brain isn't broken, it's wired for creativity and spontaneity. With the right tools, you can harness its power. Section 9. Embracing your neurodiversity, a positive outlook. Living with ADHD is a journey, not a destination. It's about embracing your unique brain wiring and celebrating the strengths that come with it. Imagine a world where ADHD is no longer stigmatized, but rather recognized as a different way of thinking and experiencing the world. By advocating for yourself and educating others, you contribute to creating that world. Remember, your brain isn't broken, it's just wired differently. With the right tools, support and mindset, you can unlock your full potential and thrive with ADHD. Practical tips for ADHD success: use visual timers for time blindness. Follow the 2-minute rule. If it takes less than 2 minutes, do it now. For relationships, ADHD explains but doesn't excuse. Communication is key. ADHD isn't a curse, it's a unique operating system. If this resonates, 1. Take the ASRS screener, link below. 2. Talk to a specialist. 3. Join a community like our ADHD or CHAD. Your brain isn't broken, it's wired for creativity and spontaneity. With the right tools, you can harness its power.